Hi, good evening. Steve Adler. Got a minute? All right, so today we have going to go over, this is Tuesday, so we'll go over a lot of data today for those of you that like seeing data. We'll pretty much just do that, but we'll dive right in. So let's take a look at the charts. Now you can see that here we're at 45 new admissions. The 7-day running average is at 30. Yesterday, as you recall, the 7-day running average was at 32. So even though we've gone to 45, which is significantly above that, our 7-day moving average dropped to 30. That's because the number 8 days ago that dropped off was our record here. You can see it at the peak. It was like at 56 or something like that. So we took a 56 off, we replaced it with a 45, and that dropped our 7-day moving average by 2 to get us down to 30. Obviously, 45 is a concern because it's up. 45 is getting really close to the 50 number and the 40 number that represent the stage when we move from orange to red, which we're trying to avoid. But we really don't know yet with a 45 and a 30 exactly what that means. Number of new cases today on the right side, 380. The 7-day moving average is 234. Remember, we talked about how the number of cases gone down over Thanksgiving. We thought maybe that reflected the fact that during holidays when people are with their families, they just don't want to go to the hospital, even if they need to or they should. And if you're in that position, go to the hospital. Might save your life. But people kind of stay back. But then right after the holiday, right after a Sunday, then the number goes up. So that's what the 380 might reflect. The new admissions, that's what the 45 might reflect. But we'll find out here over the next several days. Those could be numbers that are rising, or it could just be catch up for the last 4 or 5 days over the holiday. But let's take a look and see where we have people actually sitting in the hospital or laying in the hospital right now as compared to the 7-day moving average. You can see that in our hospitals right now, we have 234 people. The 7-day average is 218. That would indicate an increase. It's significantly higher than the 7-day moving average, and hospitalizations are significant. But the most important number, our stress point is ICUs. We have 71 people in the ICUs. Our 7-day moving average is 75. So on that key metric, that one, we're below the 7-day moving average. When we have a spike where we actually get too taxed, it's going to be in our ICUs, won't be our physical space. It'll be that we just don't have enough trained personnel to man all the physical spots that we could have. And if that hits us the same time it's hitting Houston and Dallas and San Antonio, there's not going to be folks to come and help us because they'll all be where they otherwise need to be. So we don't know at this point. The number is kind of flat, now increasing, but maybe that's the result of catch up over the Thanksgiving. We just don't know. We're going to have to continue to watch. And if there's a spike after Thanksgiving, because people were with other people, we'll see that spike in about a 2-week period of time after that. So not this week, but next week. Is when we would really see a spike coming from Thanksgiving with respect to hospitalizations. So we'll continue to discipline, do our best, keep the number down, wear our masks, and do our social distancing. And again, I remind you, if you did Thanksgiving and you ended up in groups, please stay home this week. Go ahead and get tested. When you get tested so that you know, and then stay home. Even if you get a negative test, best to stay home this week because you could get a negative test just because it doesn't manifest itself. It takes anywhere from 5 to 14 days from infection to actually feel it. Most of them come in the first 7 days, which is why we're asking people just to, and not just us, but the CDC, asking people to isolate for a 7-day period of time. Total number of cases, 38,757. As you can see, getting precariously close to 40,000 cases. Number of people passed away, 484. That's one more from yesterday, which means that there is one family in Austin today that is grieving the loss of a family member. All right, let's run through the additional data as we do on Tuesdays, and then we'll say goodnight. Begins with confirmed cases. This is the number of cases. You can see we went up and then we came back down. This chart does not have today's number, the 380, and you can see that on the 380, that number is going to go back up. 380 is about where those high peaks are that you see there to the right that are in blue. We're going to get another one that is today's number when it's shown on that chart. We'll be at that level. Let's go to the next chart. We'll take a look at admissions. That's how we do our risk levels in the city. And you can see the blue line is the actual numbers. The yellow line is the 7-day moving average. And you can see how we've kind of leveled there. And the 7-day average, as we know, moved down by 2, even though the number went up to 45. Given that 45 number, I'm not confident that the 7-day moving average is going to stay down low. Look at the next chart. This is the University of Texas chart. Shows us what the model predicts. And with people not showing up as new cases, not going into the hospital over Thanksgiving, the numbers gently pulled back. And you can see that's what the model is reflecting. If that's real, if that wasn't just the result of people staying away because of Thanksgiving, then we're in a pretty good place. If, on the other hand, that was just the holiday, then this chart you're looking at right here, right now, probably doesn't mean very much at all. Let's go ahead and look to the next slide. The next slide is how Austin's doing compared to other cities. And this is the number of active cases per 100,000 in the population, so it adjusts for city size. The one at the top, that kind of gray line, maybe a little purplish, is El Paso. And you can see that their number is starting to taper off a little bit, but still increasing and rising. They're hoping that that's flattening, but look how many cases they have per 100,000 people. That's why they have so many people that are dying in El Paso. It's also why if you have a heart attack or a car accident in El Paso right now, more difficult to find space. That's why patients from El Paso were being seen in other parts of the state, including Austin, Texas. The line right below that is the line for Lubbock. And you can see that that number maybe is leveling off too, but still increasing. But those are the two real outliers. That's about 2,000 cases per 100,000. The next two lines, the green line and the orange line, are Dallas and Fort Worth. You can see that their numbers significantly below Lubbock and El Paso, but that their numbers seem to be increasing. And that's a concern for us to see that in Tarrant County and in Dallas County. And then if you go down below that, there's that yellow line that was higher than Dallas and Fort Worth, came down and now is tracking upward with the kind of the light blue line that's underneath that. So that's Harris County, Houston in yellow, and that's San Antonio that it is right on top of. Numbers significantly lower per 100,000 population, but numbers seem to be rising and increasing. So we're concerned. San Antonio went to a curfew at night in order to help address what they're seeing in their community, kind of like us, where you see infections. A lot of it's happening in social gatherings, friends and family going over to somebody's house. They put in a curfew, I don't know if it was 9, 10 o'clock, something like that, in order to try to discourage that behavior. Whereas Austin on this chart, Travis County, it's all the way down at the bottom. And you can feel good about that and proud about that. We're the community that is, by and large, disciplining, reacting when we change risk levels, fighting really hard this community to keep schools open and to keep businesses open, such as they are, to avoid even the curfew if we can. So we should feel good about that number, but we can't rest on our laurels. We have to maintain this discipline until the vaccine comes in. We're being told that the vaccine could start reaching us in Texas and in Austin before the month is over, toward the end of December. Looks like the recommendation to the CDC today was that the first people to get it are frontline hospital workers, because they're dealing with people that are infected all the time. And then their recommendation to the CDC was that the next group to get it would be folks in nursing homes, because when they get it, a vastly disproportionate number of that group dies. They're older, they have comorbidity, other conditions which make them more susceptible. So that was a recommendation of the advisory group. It goes to the CDC chair. He'll make his recommendation on Wednesday. It's not binding on the states, but most states follow that recommendation. But you should feel good about that chart. Let's go to the next graph. This shows us positivity in our city. Remember, we had gotten down to 3.3 positivity. That was our low point. That was probably about 8 weeks ago, about 2 months ago. We've been plateauing at that place for a while. Then you saw we started going up to 5.4%, 6.8%, down to 5.9%, back up to 6.8% positivity. We're trying to get to below 3%. As we got to the 3.3 before, certainly below 5%. So you can see we still have work cut out for us. If we get a spike from Thanksgiving, that number will increase. The positivity is the measure of, if you walk into a room or go down the street and you pass by a stranger, you talking to somebody, what are the chances that that person has the virus? The greater the chances that person has the virus means the greater the chance, if you're in a room full of 10 people, the greater the chance that more than one of them has the virus. And it's that positivity that tracks with the ability to keep schools open and businesses open, which is why we need to drive down positivity. I'd point out again that what we're trying to do here is to keep our ICUs from getting filled. I continue to hear people that don't put on a mask, and they say, I don't need to put on a mask. Don't make me put on a mask. Not your business. I'm just risking my life, and I get to decide if I'm going to risk my life or not, so I get to decide if I'm wearing a mask. That is absolutely the wrong way to look at this. That's not right. The reason that you have to wear a mask is because it protects other people, but more than that, the reason you need to wear a mask is to protect the number of people that end up in ICUs. And there is no argument but that if people don't wear masks, more people end up in the hospital. Whoever they are, whether they want to take a risk for themselves or for everybody else, or they didn't care, they end up in the hospital. They end up in ICUs. We fill our ICUs if you have a heart attack or an automobile accident. It's going to be harder to get care. This whole thing is about trying to keep people out of ICUs. But you can see what that positivity number is. Make sure you have that breaks out by demographics. That general number we have in the city of Austin, you can see here 4 groupings of colors. Those are the 4 last weeks that we have. And you can see the red line is the 5% positivity. The green line is 3% positivity. And you can see that right now in this last group that we have, it's the American Indian or Alaskan is the blue line to the left. It's pretty high, but it's also a really small number of people. The orange line that's close to 5% is the Asian community. The gray line is Black or African American. That's the positivity there. The gray line is Hispanic or Latino. That's gotten up to 10%. The purple line is other. The pink line to the right is the white community. So that orange line that disappeared was Native Hawaiian Pacific Islander. We don't have anybody that contributed to that number, so it is blank. But as you look across that, you'll see gentle increases in positivity, but basically fairly flat. That's by race. Let's take a look at age. And here are again 5 weeks in each of those 5 clumps of colors. And you can see the groups that we're seeing that are increasing are the ones off to the right. It is the what is that, a pink line all the way to the right, people over 80, kind of that blue turquoise line is 70 to 79, and that's increasing. Also the 50, 59, and the 40 to 49. Before, we had an increase in positivity among young people, a lot of them feeling kind of bulletproof. We expressed the concern at the time that even though they're not ending up in the hospital, a lot of them aren't going to know they have it. They'll be hugging other people. Other people will get sick. They'll end up in the hospital. And I think that's the kind of thing that we're seeing now. This gets us back to a pattern that looks more like what we were looking like earlier in the year before the younger folks started getting it. That's the concern we have. One more chart. Again, this is one we should be able to feel good about. This is flu. The colored lines at the top are flu for the last 3 years. The blue line down at the bottom is flu this year. It has the numbers only through the 3rd week in November. So October's filled in, November just through the 3rd week. And you can see we've stayed at roughly 1%. If we could sustain that, that would be great. Last year, as you'll recall, we filled our ICUs with people with the flu. There's not going to be space this year. It's going to really tax us, but we control this. And I think people wearing masks right now are probably helping with the flu. Greater number of people getting flu vaccines helping with the flu. If you haven't gotten your flu vaccine yet, you should make sure that you do that. But we should feel good about that number. We should feel good about the number of cases per 100,000 in Austin, but we need to maintain the discipline that we have, and we need to watch and see what happens over the next week or two to see if we get the same kind of uptick that we're seeing in states across the country, but most importantly, to see how we did here locally with respect to the vaccine take-up. Those are all the numbers that we have. We have no Got a Minute tomorrow night because we have a city council meeting. But at the end of the city council meeting, probably about 5 minutes after it ends, I'm going to go on Instagram live and talk about some of the action. And actually, that's Thursday. I'm like jumping ahead. So Thursday will be Instagram. Tomorrow, Wednesday, we're going to do another Got a Minute, and we'll take a look at the numbers. So tomorrow, Got a Minute. On Thursday, I was excited. We'll do the Instagram live at the end of the council meeting. With that, wish you all a good night and take care and be safe.